Okay, now I show you bad results as well, because we talked about failures. And I showed you this negative development in the field, that we see too many cowboy techniques in the field, very aggressive surgical techniques, and then you see then outcomes are not so good. How to fix? In the aesthetic zone, I mentioned that is one of the complication rates of failure modes we see quite often. And most often, as I will show you, this is caused by the clinicians because of the malpositioning or other mistakes. So we're going to talk about this indication now, failure by mucosal recession. So it looks ugly. And I will give you first a certain case analysis to see what went wrong that we had a problem, so you understand the cause. And then how to treat. And then I show you 5 cases we treated. Professor Belzer and myself have now treated almost 100 cases like this. And we are preparing with Quintessence a book that will be released hopefully in about 2 years. Next year, we are planning to have the 3rd GBR book out at EAO in Berlin. The 3rd GBR book will be hopefully available, and Sasha Jovanovic and Istvan Urban, Frank Schwartz, as all the top guys, besides the Bernese group, who will be authors in that book. And the year after then will be the book with Professor Belzer on aesthetic failures, how to manage these aesthetic failures. Good, okay. The potential causes, you see, most often improper performance of the clinician, so they screwed it up, of course, when you want to summarize. And the number 1 is the most often seen cause, it's the malpositioning of implants.